Trimethoprim is an antibiotic. It's used to treat and prevent urinary tract infections, UTIs, such as cystitis. Occasionally, trimethoprim is used to treat other types of infections, such as chest infections and acne. Trimethoprim is available on prescription. It comes as tablets and as a liquid that you swallow. Trimethoprim can be taken in pregnancy, but it is not recommended in the first 12 weeks. This is because it is an antifolate, which means it may decrease your levels of folic acid, which is important in the early stages of your baby's development. Sometimes, trimethoprim is the only suitable antibiotic to treat an infection. In this case, the benefit of taking it is likely to outweigh the small risk of harm, but discuss this with your doctor. Some side effects of trimethoprim include itchiness or a skin rash, nausea, and diarrhea. Trimethoprim tablets contain 100 milligrams or 200 milligrams. The liquid contains 50 milligrams in 5 milliliters. The usual dose of trimethoprim to treat urinary tract infections, UTIs, is 200 milligrams twice a day. Your doctor might recommend you double the first dose to 400 mg. What medication would you like covering next?